Good afternoon, everyone. Hope I'm audible to all. So, I would like to welcome each one of you to this very interesting session, especially for those PG students and also early career persons who are eager or keen to know on possibilities or probabilities of going abroad, especially to the UK and practicing. So, for that session, I have my friend and fellow who had done fellowship along with me at Malabar Cancer Center, Talasheri. She has done her MD in transfusion medicine and now she is working at University College London. And we already had shared a Google form by which we got the queries which she can address. Most of the queries she would be addressing in the coming few minutes, but certain queries were out of her bounds also. So that we might take in later sessions. So I would like to invite Dr. Shweta Gupta to take us through her journey from transfusion medicine in India to hematology practice in UK. Welcome you, Dr. Shweta.
Thank you, Rafi, and good afternoon, you all. And thank you for joining me here. I know you are quite busy with Diwali coming and on the day of Diwali, so wish you a very happy Diwali from my side. So, can you see my screen?
You'll have to share screen once more.
Okay, one second. Is it full screen or no?
We have to go to the first slide. It's not the full screen.
Okay. Is it full screen now?
Yeah. Now it's full screen. Go ahead.
Okay. Sorry for this delay. So, so basically, we are going to, talk about, as Rafi was telling you that, if you want to transition from transfusion medicine to hematology, or like if some of you are interested in coming to UK and working. So like, it's not a very general, it's not like, very generalized thing, but it's like it's my journey and what I mean how I have done it. So I'm just going to share that experience. So there were a lot of questions, and most of you guys wanted to know that how I did it. So I finished my MBBS from Sri Ramchandra Medical College in Chennai, and then did MD IHBT from BJMC Ahmedabad. After that, I worked as a clinical assistant in Hinduja Hospital, Mumbai. I worked there for almost an year, and then I decided to pursue hematology because it interests me. And then mostly because like of its diagnostic and the clinical perspective as well. So I worked, under one of the hematologists there, and then next year this fellowship came from Malabar Cancer Center, and I applied for that and got into fellowship. So meanwhile, I was doing my fellowship. I decided to, write an MRCP exam. So I did my part one then while I was doing my fellowship. And then when I completed my fellowship, came back to Mumbai, joined as an associate consultant in Kokilaban Hospital. There I completed my part two and PCS exam. And then in 2020, I came to UK. So in UK, I am right now as a senior clinical fellow in University College Hospital. So some of you wanted to know what my job profile is, or like what basically I do. So I'm a full practicing hematologist here. So I see, all the inpatient and outpatient, and here we kind of rotate as like we do a specialty wise hematology. So we do like 3 months of lymphoma, myeloma, leukemia, clotting, transfusion, and then both as an inpatient and outpatient job. And simultaneously, when I came here, I did my FRC path because like when you want to practice in hematology in UK, you have to do FRC path clinical hematology. So I cleared that, and right now I'm applying for a consultant job in UK. So that's about me. So then the question comes like, if you want to transition from like transfusion medicine to hematology, what are the options? It's all depends upon what you want to do and what your choices are. But whatever I know, there are like few institutes which offer a fellowship after transfusion medicine. Because still, the transfusion medicine is not accepted by I mean, as a fellowships are not accepted by various institutes. So one of few of the institutes which offer the fellowships are CMC Vellore, so which offers around like the fellowship of 2 years. Then MCC Talsheri like 1 year, and Maharashtra University Health Sciences Iron Hospital offers a fellowship of 1 year, and DMC Kolkata also offers a fellowship, I think 1 to 2 years. So these are the few which I know of. I'm not sure in recent years if other institutes have come up with the hematology fellowship. Now the question is whether like, what you have to do when you are applying for these fellowship and how much you have to prepare. So from my experience, I can say that like, it would be better if you work maybe under a hematologist for like, 3, 4 months or 6 months and see what exactly hematology is and whether you like it or not. And then, go through the basic interview process and exams. And then, because I'm not sure like how the CMC Vellore and other hospitals work, but most of the hospitals, so they have the interview sessions, and they will be asking basic questions about like why are you interested, and maybe 1 or 2 clinical scenarios which will be like easy to go. So after when you finish your hematology, so the question most of you have asked whether like you're eligible to practice after doing this fellowship. So we need to understand that these fellowships are mostly institutional based, and ideally speaking, when you do these fellowships, you can practice in the respective states because these are recognized by the state medical council. So obviously, yes, you can practice in that state. But I should not be saying but if you go off records, you still can practice in any part of the India, and specifically in like tier 2 cities. Uh, I mean, considering what hematology is, I would say that like if you practice benign hematology, general hematology, that's fine. Malignant hematology or prescribing chemotherapy, still it's a bit of a gray area, and I won't suggest going for a transplant with these fellowship until unless you are very confident and you have a good backup. So this is my opinion, but individual opinions may vary. So now, if you have done, fellowships, and if you want to work in UK, so the one and the basic thing which you require is a GMC registration. So there are two ways by which you can, achieve the GMC registration. One is either by writing a PLAB exam or by writing a MRCP exam. So both of them has pros and cons. I'll be running one by one. So it's a GMC registration is basically same as what we have, Indian Medical Council. So it's called as General Medical Council, and it will give you a registration. And and only after getting that registration, you're eligible to practice. So the PLAB, it's basically the Professional Linguistic Assessment Board test, and the eligibility for this is like MBBS, including internship. You need not to, there is no need of, MD for this exam. You can still give it, after your internship. And if you see, this exam happens in like two parts, part one and part two. So the part one is like multiple choice questions, which happens in India, and the part two happens is all in UK only. There is no centers available in India. So if coming to the cost wise assessment, so the part one is around 25K, part two is 90K. And if most of the candidate usually take a coaching for part two, because it's a practical exam, and so the coaching will cost you around 50K, which is mostly in UK, or you can take as online as well. So if you talk about the study material, you can, as mentioned on the slides, there are few study material websites you can choose. Either you can have a Plappable or a Plappy. Both of them are online subscription. And then, but before applying for the GMC registration or applying for a job, you need to, clear as per the mandatory, requirement for before you work in UK or US. Like you have to clear this English exam, which is again called as OAT or IELTS, and each of them will cost around 25K. So I would prefer OET, because it's basically they'll test your reading, writing, listening, and communication actually. I would prefer OET because it is medical based. Otherwise, IELTS is basically like, most of like in general queries or politics, like, basically they'll test your general knowledge. And I know that my GK is not very good, so I preferred OET because it's mostly medicine case based exam, and that too they test your English on that aspect as well. And then once you cleared this exam, but then obviously, as I said, that the part two exam, when you have to go there and write it, so you need a UK visa, and you have to like stay for almost I would say 1 week to 10 days. Why I'm saying the 1 week to 10 days, because exam is only one day, but people prefer to have the coaching, and the coaching can be around 2 weeks time, or maybe for like 1 week to 10 days as well. So including all these costs, it would be around 3 to 4 lakhs. Now, so this is the PLAB. Like if you see grossly, the PLAB would cost you around somewhere 5 to 6 lakh. So when you do a PLAB, the jobs in UK which you are eligible for, because PLAB is very basic exam, which allows you, to just enter into the UK. And in terms of job, like you will be applying for an SHO job. When I say SHO, that means like senior house officer, which would be like an internship. And then, that would be a job profile you will be having when you apply for a PLAB. But if you want a registrar or a senior position job, it's better to do an MRCP, before going to UK, or else what you can do, you can do a PLAB here, because it's an easy exam. Go there, work, and understand the system, how it works, and then you can, write the MRCP and go from there. It's a long journey, I know, but that's how it is. So the other, as I was saying, that like the other way you can go for a GMC registration would be an MRCP. So basically, MRCP is a membership of Royal College of Physicians. So again, it is like the eligibility is MBBS. You need not to be MD, but I know that like every one of us like are either like pursuing a MD, or have completed their MD and working. So I suggest that MRCP would be a better option here. And then again, this exam has runs into three phases: part one, part two, and PACES. The last step, the PACES, is clinical exam. So, and few of you have asked me the question about like, what is the difference or how it is different to prepare for an exam here and to prepare for an exam in UK. So how different it is. Or the other question was whether, like, how much, like, how many years or how much time do you need about for preparation of these exams. So from my experience, I can say that when I was doing my fellowship and I decided to write my MRCP, uh, literally it took me around 1 year to kind of enter into the groove of reading. Because once you have done your MD, and then once you are, if somebody asks you to again read or go and practice medicine, like not exactly practice medicine, but like go and read the biochemistry, or a bit of physiology and gynec and neuro and cardio, you are going to take time. But then yes, I can say that, like, once you are into that groove, and it's very interesting, and you will love. Because what I feel when I was doing my fellowship, that I was preparing for an MRCP at that time, and it really helped me in sharpening my clinical skills while I was doing hematology. Because when you're doing hematology, it's mostly medicine, day-to-day practice, small things, like you are managing your patients, for example, as small as, like, managing their sugars, replacing potassium, or maybe treating and acute kidney injury. These are the very small examples, but what I'm trying to say is that it helped me while I was doing my fellowship as well. So once you're into the groove, like it's usually take, like 3 to 6 months to go through, to prepare for the part one and part two. Basically, once you start preparing, you will see that though they say part one and part two are different, but in terms of their expectations, part one and part two are like same. So what I mean to say, that if you start preparing, and that, like, you are good to go ahead, you can give part one and part two within 6 months. So these are a few of the study materials which are available online. So maybe you can subscribe online. So past test is one of them, past medicine. I use past test, and the cost can vary from like 10 to 15,000 per subscription. Or either you can take a subscription for 3 months, or maybe 6 months, or like 1 year. So what I mean, basically the part one is all about MCQs. And the best part of these exams or MRCP is that they are very practical exams. That means, like, they don't ask you, they don't expect you to answer numbers. Like, they don't expect you to answer the percentage of this disease or percentage of this syndrome. They expect you to go through the clinical case scenario, and like what you do in daily life, like with the patient. So that's what I feel it is a very good exam. So that's part one, and it includes like 2 3 hours paper, and there will be multiple choice questions and extended best out of 5 questions as well. As per the guidelines, it says that MRCP, I mean, part one is, basically they try to understand your knowledge of diagnosis of a case, or diagnosis of a, case scenario. And part two, the questions in the part two will ask you about how the management is being done. And both in part one and part two, there is a, like a very small component of basic statistics test, actually, which we have read in our third year of MBBS. But yeah, most of us have forgotten that. But yeah, there is a very maybe 10 to 15 questions will be there for from the basic stats of in MRCP part one and part two. So part one runs in January, April, August, and October. And so that means, like, it runs like, 4 times a year. And the fee would be, if you are giving in UK, it is £460. That means like 46,000. And if you're giving in India, or any other country, actually, then it would be around like 60,000 to 65,000. And it is an online exam. So, you need not to go anywhere. You have to obviously go to the exam center, and you can write the exam. So this is about part one. Part two, again, it happens in every 3 months, so every 4 months, and usually it happens in February, May, September, November. And again, initially when I gave, they were like, this exam was on 2 days, but right now they have made it to 1 day. So again, there are two papers of 3 hours, and there will be 100 multiple choice questions. And so the scoring system in MRCP or in part one and part two is a bit different. So they score you how much so they score you more if you have attempted much more difficult questions, then you will get more score, and the score is on the relative basis. So obviously you will be scored depending upon how much the highest score goes. So that's how the scoring system is from in part one and part two. Now the PACES. PACES is the clinical or in the last step of the MRCP exam. And it is, I won't lie to you, but it is a difficult exam. In difficult in sense, it is it is the exam which we have, done in our internship, our medicine exam, but it is very fast and it's very, it is within 3 hours of exam, and it runs into 5 stations, and every station is 20 minutes to 10 minutes, and you have to just be very thorough and very quick in this exam. So it also runs so what, when we say paces, we say tire, it runs 3 times a year, and so it run in tire 1, tire 2, and tire 3. So January to March is 1 tire, June to August 1 second, and September to December is 3rd tire. So what happens is in PACES exams, so part one and part two, obviously you apply, and definitely you are going to get your seat or your approval to write the exam. For PACES, it's a lottery system. So what happens is you apply. That's the one of the, I would say, not a good thing about PACES. It's a lottery system. So you apply, you might not get the approval, not the approval, you might not get the seat in that tire, and then you again have to apply. You have to pay the fees of the PACES for this exam only when you get a seat to write the exam. And obviously it's a lottery system, so you can't say that there is no need of being disappointed that why you didn't get this time. So in this scenario, PACES, even if you're ready, it's a bit of luck that you might not get the seat, or maybe you might not get the slot to write the exam when you're ready, or in that month, or in that year. So you have to apply next. So it might take maybe 6 months to 1 year, or 1.5 years for you to write the exam. So that's happened in India, because the centers of PACES exam in India, like Delhi, Chennai, Kolkata, Hyderabad, Trivandrum, and few more. But so that's why if people want to avoid that slot system, what they do is they, if you're quite well financially, good, then you can go and write the exam in UK, because UK, the exams it happens 4 times a year, and so there are much more seats available, and there are chances that you can write the exam, and you can get the slots more easily. Or maybe some people can go and write the exam in Singapore as well, because you can easily get the slots there. So that's how the basis is. So the one thing which I would say is part one and part two is easy. You can write it from any place. Basis, it's from my personal experience that because PCS is clinical, and I got the slot in India, I wrote my exam in Kolkata. What I feel is that it is it is difficult if you just if you have to go and write a clinical exam or give a practical exam in other country. There are two reasons. One is you're not accustomed to their system, and the other thing which I would find it difficult is the slang or the accent, because most of the time if you are going to UK, or maybe you get a center in a remote part of UK, the accents are very different, and what the patient is saying or what the doctor is saying, you might not able to catch up very quickly. So that's what I prefer is to write in India, because obviously you are well versed with the system here, well versed with the accent here. And so that's my personal experience. I feel that this makes like more a huge difference, because anxiety levels go very high when you don't understand the accent, and time pressure is a lot, and when you have to perform in just 20 minutes or like 10 minutes. So yeah, I would say that, like, if you try to get a slot in India if you're planning to write basis. So the fee for this exam is quite high. So this is like around like 1.2 lakhs if you're writing in India. But like if you're again going, in UK to write this exam, the cost of the travel, the stay, and the visa again increases the cost enormously. So overall, if you start, preparing for the MRCP, from today, like you need almost like 1 to 2 years to complete all the parts. And then, meanwhile, the other good thing is that, like, meanwhile you are doing an MRCP, you can still apply for a jobs in UK, as a specialty registrar or as a clinical fellow in hematology. If you have just completed your fellowship in hematology, because what happens is, like, some of the institutes, like, they still allow you to practice. They'll sponsor your GMC registration, because when you do an MRCP 1 and 2, you are still don't have an GMC registration. But some institutes, like, if they really want you to work, then they will sponsor your registration, so you can come there after doing MRCP 1 and MRCP 2, and then write the pieces while you are in UK. So that's also a good option. But I won't say there are many institutes who prefers this, like they sponsor your GMC registration, but still there are there. So you have to just keep applying and see, like, if they can sponsor your registration. So this is the kind of a bit of a diagrammatic representation how the paces go on. So there are 5 stations, and each station is of 20 minutes. And for example, in station 1, you have one communication and one of the systemic examination. So in communication, station can be anything. It can be basically it is to address the patient concerns. It could be breaking a bad news, or making dealing with an angry patient, or dealing with a patient who has a low mood or a mood disorder. So yeah, so these are the communication stations, and in every station you will be marked by 2 examiners individually, and then you will get a 5 minutes break, and you move on to station 1, I mean, like the next station. When it comes to consultation, there will be 2 consultation stations, and each of 20 minutes. So in one of them, they'll ask you about the history. I mean, they'll assess your history taking capabilities, and to take the history, and then to reach or onto a differential diagnosis. And then again, the systemic examination, like cardiovascular and neurology for 10 minutes. They will be very short cases. You have to just given a history, you have to examine the patient, and tell the examiner what could be the differential diagnosis, and then they will ask you questions on that. So when I say it is difficult examination, because you just get like 5 minutes, to, I would say, 4 minutes to 5 minutes to examine the patient, then 3 minutes to present your case, and then, like, next 4 minutes would be the examiners to ask you a question. So it's very, very quick. And so it's like it's all practice. The more you practice, the more fast you go. And like, so that's how it is done. Like it's kind of automatic action. Once you are into the groove, like you just go from like top to bottom. So that's how this goes, and how fast you have to be. So again, this the other station and the last consultation would be like there will be two short cases of 10 minutes. There you have been given a scenario, and then you have to just talk to the patient, and uh, depending upon the history or what the symptom is, and then you have to come to a diagnosis, and that's how you have been marked. So now these two were the options, like when you need GMC registrations. Now what are the options in UK? So once you sort your GMC registration, so either you can come to UK and do a CCT. CCT is, I would say, equivalent of a DM hematology in India. It's called as a completion of core training, and or you can do a CSER. CSER is Certificate of Eligibility of Specialist Registration. So CCT is basically, as I said, it's kind of a DM hematology in India, and this program is like 5 years. So we have like DM hematology 3 years in India. This is 5 years, and the basic requirement to enter a CCT is like you have to complete your MRCP or MRCP equivalent. There are few scenarios what they do when they they don't need your MRCP is that, for example, if you have given your blood and then you are working in a medicine department and you have already your competency signed. When I mean competency, there are few bits and pieces, like for example, this procedure, you have been posted or you have worked in certain specialities of medicine, and then your HOD or the head of the, or like any of the seniors have signed and say that, and then if you have the documented evidence and you can submit it to the college, though they might consider that like you are equivalent to an MRCP candidate and you need not to do an MRCP, and you can enter into this training program. So to enter into the training program is easy. Is not as like it. There is no. I mean, there is no exam as such, but the process is like you have to, fill the application, and then you are like sorted out depending upon your scores. So the score is based on like if you have done any quality audits, like what is your previous experience, including your PG post graduation, because they include your post graduation as experience as well. Then how many years of work you have done, or a clinical practice you have done, like after post graduation. So basically in UK, the basic thing is there they count all your experiences as work experiences after your internship. So even if you do a PG, it is a work experience. So how many years you have worked, audits, like you have any papers, or so these are the things, like they score you, and if you have any teaching experience can be any teaching nurse, or like if you have done a leadership program. So all these things are there, and on depending upon that you will be scored. Depending upon the scores, then you will be called for an interview. The interview is basically an online interview, and in that online interview they'll give you a few clinical scenarios you have to answer. It's quite easy. You want to do clinical scenarios, they'll ask you to make a presentation of a case which you have recently seen, but you to present a case, or and maybe a bit about like why you want to why you want to do hematology. So that's how the interview process happens. And once you got selected in interview, like you can opt for the colleges or the hospitals in London or outside London, and the whole completion training is like 5 years. So that's how the CCT, and then you can directly apply for a consultant job. So if I have to say, this is one way. The other way is CSER. CSER is the Certificate of Eligibility for Specialist Registration. So for example, like people like me who have not been trained in India, sorry, who had not been trained in UK, or like, they have to go through this process. So for me, because I have done my MRCP, the options would have been I could have done enter into the training program, but I didn't enter because it is 5 years, and I thought when I started working in hematology here, I thought that, like, 5 years would be, I won't say waste, but like 5 years I won't be doing anything new. I would be doing the same thing which I have done in India, so I didn't enter into the training. So that was my reason for not entering into the training program. So for me, the option is like, or people like me who have not been trained in UK, the other option is CSER. So it's a certificate of eligibility of specialist registration. It's a bit longer process in the sense because so it basically it's more of a documentation. So you have to provide all the documents whatever be needed by the GMC or the General Medical Council in UK to prove yourself that you are equivalent to a trainee here. So that includes that you have these many years of clinical experience in UK, or not UK, back in India or back home. And then you have seen outpatients, you have seen inpatients, you have done procedures, for example, a bone marrow or like lumbar puncture, you have given intrathecal chemotherapies, you have so all these things you have to prove, and everything had to be has a document. Somebody has to sign it, and then sorry, you have to submit it to the GMC, and the GMC will approve that, okay, fine, you are equivalent to a trainee and you are eligible to practice as a consultant. So that's the one option, you can have it. Now the question comes like FRC path. Why we need to do an FRC path? So basically, in UK, in Australia, or in I'm not sure about the US because they have their own hematology board. But in UK and Australia, if you want to practice clinical hematology, you have to give FRC by clinical hematology, because the basic thing is, if you're clinical hematology, you are expected to know and to know that how you see your own bone marrow slides or a peripheral blood film, or you can interpret a coagulation result, or like you can interpret like all your coagulation and clotting difficulties. So that is what the basic principle, that like you have to do an FRC path. If you are into a training, if you are entering into a training program, a CCT, it is mandatory for you guys to, for anyone who's entering into, for the trainees to do an FRC path, because until unless they do an FRC path, they are not going to get their completion of core training, that certificate, they are not going to get it. So yes, for them it is very mandatory. For like if you are doing a CSER, so you have to do again, it is very important. It will give you an over edge to practice in UK, so that like you have to do an FRC path. So again, this exam is like based in on part 1 and part 2. Part 1, it is MCQ based exam, and this is like so MCQ and essay. So it is a morning and afternoon exam. In morning you will have essay, so there will be 4 essays, and in MCQs there will be like 100 MCQs actually in the afternoon. So there will be 4 essay, and when you see the FRC path exam, so it will assess you on general hematology, malignant, transfusion, and clotting. So one essay from each of the specialties, and the MCQs will be from the respective scenarios will be there. So you can do FRC path from India. So the prerequisite for FRC path is like, you have either, the first thing is like either you have an MRCP UK or equivalent, before attempting the FRC path exam in hematology. That's the college guidelines. But they have also mentioned equivalent. And when they say equivalent, so like if you have like a good practice of hematology in like 3 or 4 years, and because each of these exams has to be signed by your sponsor, who says that you are fit to go ahead to give the exam. And if the sponsor is like FRC path passed, then he can or she can sign your form, and then you are eligible to write this exam. So it's not as few of you have asked, like, do we have to, do an MRCP, before writing the FRC path exam? I would say no, but then you have to have at least like, 3 to 4 years of practice in hematology to, be eligible for at least writing part one. And you have to have a sponsor or a person who is a FASIPAT and who can sign your sponsorship form, because each of the part have this sponsorship form. So in terms of the exam fees, it is a costly exam. If you write, like, it is around like 707 pounds in UK and around 70,000 in India. And for the preparation, you can go through the BSH guidelines, which is British Society of Hematology, because UK people loves guidelines, and they always go by book. So they are like, they don't go off the records or off the book. So whatever is in the guidelines, they follow. So if you're interested in hematology, or if you're planning to go for a fellowship or course, or a fellowship, applying for a fellowship, I would say BSH is a good website. It's a free website. You can go through the guidelines and you'll get every guideline, including the transfusion, general hematology, malignant, clotting. Every guideline will be there in that. You can have Blood Academy. Again, this is a website. And Heme Base. Again, this is again a website for the preparation of a FARSI path. And all these are free websites which you can access. So then it's the part two. So basically the part two is designed in such a way that, they assess the core skills required of a consultant hematologist. And this exam is again a quite tough exam because it runs over 3 days. And basically in this exam, like, you have to have a knowledge of morphology. So you will be asked to, see the bone marrow slides and the peripheral blood smears, and, write down the answers depending upon what they have asked. So there will be some short cases, there will be some long cases. And the second day, that will be the first day where you have to ask to assess the morphology. The second is a theory exam. So the transfusion and the clotting, it's a theory exam. So they are going to ask 8 questions of transfusion and 8 questions of clotting, each of 2 hours, and 2 hours. And then the third day would be an oral exam, which will be a grand viva. So the viva runs for 1 hour. And the fee for this exam would be like around 1.5 lakhs, in 1.5 lakhs. So the other, I won't say drawback, but the part one you can write in India, but part two, the centers are only in UK. So again, you have to come to UK. The other thing is, like, even if you're writing an MRCP is okay, like, you can write in India, but FRC path, I would say that, like, if you are planning to come to UK, it would be better if you come to UK and write the exam, because you know how the system works and what they expect out of you. Because there are a few small changes where we find it differently, because here they are more concerned about very small details about the patient, and patient concerns, and community management. So these are the things which, like, when you're into the system, you'll be able to know, and it's easy to pass the exam rather than being in India. So that's what I would suggest. Last but not the least, a few of have asked me that whether you can write an FRC path, like, or a transfusion science exam. and what are the options for it, like, and options for it, like if you're directly coming to UK and want to practice transfusion medicine. To my experience and what I have seen so far is transfusion medicine is not practiced here as an in isolation. It's a part of clinical hematology training. So you it's yes, there are consultants who practice only transfusion medicine, but again they are the people like who had gone through the hematology training and wrote their FRC path exams, and now by choice, they are practicing only transfusion medicine. Yes, they are there, but I mean, if you ask me. That like if you can write only FRC path transfusion science, I would say no, because this is, if you can see on the slide, this is directly taken from the college, and it says that it's basically the transfusion science exam is essential is for the people who want to be clinical scientist, or lab tech people. So there is no role of a consultant to write this exam. If you are a clinical scientist and you want to be a consultant clinical scientist, yes, you can write this exam. But what are the prospects of only writing this exam and being a consultant here? I'm still not sure, because I think nobody has explored this pathway. But this is the information what I got from the college. And when I was, when I was doing transfusion medicine, not doing transfusion medicine, but I completed my transfusion medicine, I was exploring about MRCP and IHBT, and coming to UK, I did go through it, and I didn't. It was a very vague that like I could not make it out whether like if with the transfusion medicine degree, how would I practice in UK? So that is still unclear to me. And that's all from my side. Thank you.
Thank you, Shweta, for taking us through your journey. I hope it was very useful, especially for the persons who were thinking about going abroad. So, if there are any queries from like, most of them are answers to the queries which had been already sent. But even then, after hearing Dr. Shweta, if there are any queries, I think you can unmute yourselves and ask too. Adria, can you make that option of they can unmute? Yeah, Dr. Kaveri Joshi, you can go ahead and ask.
Hi, Kaveri.
Not allowed to unmute myself.
Yeah, now you can. Go ahead.
Hi, ma'am. Ma'am, my question is that do you advise that we practice clinical hematology for a couple of years or maybe 3 years after completing our IHPT before thinking about taking MRCP and before trying to come to the UK? So, do you suggest that we try and practice here in the Department of Clinical Hematology and then go on this pathway?
I'm not saying that you have to, practice for 2 or 3 years. Like you can write your MRCP exams while doing your fellowship. But then what I'm saying is that if you're planning to do a hematology, like if you're planning to do hematology in UK, then it would be better that you have some hematology experience here. And the more the experience you have, the better it will be. So
Okay. Okay, ma'am. Okay, ma'am.
it,
Thank you.
yeah, it's not mandatory that you have to, like, you can write a MRCP, without practicing it, but you need to be clear that like after going there, what jobs you want to apply. So that's the thing.
No, my question was that if for example I am currently doing my SRship in clinical hematology directly
Okay.
after my IHBT, so
Okay.
am I allowed to go and apply for fellowships straight away to the colleges if they are offering any? Do they accept without a licensing examination? Are we allowed to touch the patients? Like in US you cannot do that, so is it possible in the UK?
No, you cannot. So again, you would so that's why like you need a GMC registration. So,
Right,
though
ma'am.
for example, you are doing, as you said, that you are doing an SRC in clinical hematology, that's good. But if you want to practice in hematology in UK, then you need a GMC registration. And whether either you do a PLAB or you do an MRCP, or, you try to apply, even if you apply like 50 or 7, maybe like 20 or 30 applications, there are few institutes like which are ready for you to, to provide you the sponsorship for the GMC
Okay,
registration.
ma'am.
Even for that, you at
Okay,
least
ma'am.
have to do an MRCP 1 or MRCP 2.
Okay, ma'am. Okay, ma'am.
Yeah,
Okay, got that, ma'am. Thank you.
no worries.
Hi, ma'am. Hi.
Hi.
Ma'am, I'm asking like whether the past test, I mean, you told like past test is better than past medicine. So like how is it about like preparation time takes about like what long so that I can
So, no, I didn't say
prepare?
past medicine is better than past test. I mean, I don't have experience with the past medicine because I did past tests for both of my part one and part two. When I
Okay.
say preparation, as I said, like my personal experience is like I took almost an year to get into the groove because, initially you guys would laugh. Initially, I took a subscription for 6 months, but then, the subscription expires and I was still not like, able to go through that, like, and then again I resubscribe it. If I talk about the preparation time, once you are ready, like once you are like, giving at least 3 or 4 hours per day, then like, it just takes like 3 to 4 months to, get onto a stage where you are good enough to go and write the exam, because these subscription sites are very good in the sense because you have the question and you have the explanations. So you go through the questions, read the explanations, you will get a whole of information about the particular disease. And then if you have any doubt, you can, I
All
mean,
right.
I would just, go through Harrison and all. Just you can just, the small book of internal medicine, Oxford manual book of handbook of internal medicine. You can just, query. I mean, go through that. That will be much more easier.
Oh, okay, ma'am. So before that, you have to just go through all those. Okay, fine.
Yes. And
Okay.
if you're giving like 3 to 4 hours per day and just practicing the question, that's what I used to do when I was doing
Mhm.
my fellowship. Like every evening, I just sit for 3 to 4 hours, make sure that like I do like 100 questions of this
Okay.
system. Take respiratory,
Mhm.
cardio, whichever is the toughest, do it first, and then revise, and then you are good to go.
Okay, ma'am. Okay. Thank you, ma'am. Thank
Hello, ma'am. Ma'am, my name is Magdalene Salmon Vargas. Ma'am, I had a query. I'm right now preparing for my MRCP. I'm taking my exam in Jan, but the confusion I had is whether the ST3 and ST4 is similar to CCT. Is that all same, or is it a different thing? The ST3 and ST4 that they're saying?
Yeah, so the CCT start from ST3. So,
Okay.
like, so CCT starts from ST3. Before ST3, you have ST1, ST2, but ST1, ST2 are the, like, the foundation years, like,
All right.
internal medicine training. So you start from ST3. There are exceptions as well. Sometimes if you have a good clinical experience or clinical hematology experience, you might
Okay.
start from ST4 as well. So they can waive off your 1 year. So the clinical training will be of 4 years rather than 5 years. But then again, this is very variable and depends upon the panel.
Oh, so is it determined by the institute we are applying to, or by the GMC, or they have any other procedure for it?
So no, it's like it's by the GMC. So, but
Okay.
then the panel will be different actually. Like, you, for example, there is a group of lot of people who will be examined by a different panel, and there will be different panel. But at the last, the results will be out, and once they will be decided by the GMC. So the panel can argue, or you can counter argue that I have an experience, so I don't need to start from ST3. I can start from
Okay.
ST4. But then the panel would agree to that, and then the panel will say to the GMC that they approve that this candidate can start from ST4 rather than ST3.
Oh, okay, ma'am. Thank you so much.
Dr. Dipshika, you can go ahead.
Yeah, ma'am. Hi. I just have a doubt. And like, I just went through, even I went to the website of the fellowship in transfusion medicine, the FRCP path medicine examination, and I did write to them whether asking whether I am eligible to write the exam, but I got some vague answers. Is there should I like not pursue that?
Deepshika, is a good question because the problem with the college is, I can say that, like, the college gets these queries and they write you the vague answers because they haven't dealt with it. Because they usually dealt with the trainees, so it is straightforward for them. So they don't know what to, how to answer and whether what is the way forward because they go by the book. I'm not saying you should not pursue. You can still write the exam. My concern would be even if you're writing the exam, and if you're planning to go to UK, like how is this exam going to help you, or whether you are going to get a job in transfusion medicine only? That's my
Yes,
concern.
ma'am. That was my question actually. Whether if I write this exam, will I be able to get a job in the UK as a transfusion medicine specialist? Or if I'm going to do a clinical hematology, if I'm writing clinical hematology, and can I again write this transfusion medicine examination again, FRCP? Or I just have to stick with that?
The clinical hematology, where you mean clinical hematology in
Like,
India?
like if I'm going to write a FRCP clinical hematology the exam, and then
Then you
if
need
I
not to write. Then you need not to write this exam.
then no need to write this exam. But
No,
I
no.
want to pursue. But I want to pursue for transfusion medicine specialist. Are there any people who are doing like that, ma'am, in the UK?
No, so
Who
that's
have
what I'm saying. Like, I have met many people, but like, and I have asked them personally, but they don't have any experience of it because
okay,
everyone who is practicing transfusion medicine here, they have all done, like, they are the clinical hematologist, but by
okay,
choice, they are practicing transfusion
transfusion
medicine.
medicine.
Yeah, so
Okay.
to answer your question, if you write a FASI path and you want to practice transfusion medicine, you're most welcome, and they will be absolutely happy to take you in because they are in crunch of the transfusion medicine specialist consultants here.
Okay, ma'am. Thank you so much.
So yeah.
Yeah, Dr. Faisal.
Hello, ma'am.
Hi, Pedro.
Ma'am, is it compulsory to pass the MTI first? Sorry, for passing the. Sorry. Ma'am, is it compulsory to pass the MRCP first and second part, and before going through the MTI route, and before exploring this MTI route?
Good question. Actually, it's not compulsory, for you to clear MRCP 1 and 2 before going to MTI. But the thing is, MTI options are very, I would say, nominal, because when I was going through and exploring this route, first of all, MTI takes a lot many years. Like, it can take like 1 to 2 years or maybe 2 to 3 years for you to get to the UK. And because based how the MTI functions is like MTI basically recruits the doctors from overseas to work in UK outside of the hospitals and basically the district hospital, and there are people like who are doing who are pursuing MTI. Like this MTI is for 2 years, and after 2 years you have to go back to your own country. So when you are doing an MTI, you can either write part 1 and part 2 and paces, and then if you are able to clear the MRCP while you are writing an MTI, while you are doing an MTI, then you are eligible to do any job in the UK. But it is not mandatory to have MRCP 1 or MRCP 2 while exploring the MTI route. And it also depends upon the specialty. So specialty to specialty, because if
Okay.
you are going through an MTI, for example, in geriatrics or example in acute medicine, there's a lot of crunch. So they don't expect you to. Yes, but if you are doing it MRCP 1 or if you have done it, you definitely have an overedge to others.
Okay, ma'am. Thank you,
But
ma'am.
frankly speaking, when I was, I was looking at the options, I didn't find MTI for adult hematology. There were many colleagues of mine, like I know 3 or 4 who were doing pediatric hematology, and they came to UK via MTI. But frankly speaking, I could not find any MTI route for adult hematology.
Okay, ma'am. Okay, thank you, ma'am.
No worries.
Any further queries? Do you have
There is
any
something.
suggestions?
There are something in chats.
Chat. I don't know if it directly came to you. Any chats have come?
I think it's. Oh no, there is no question.
Ma'am, there is one question. Two questions are there actually.
Okay, can you
One
read?
is, yeah, is paper writing important for getting a job in UK?
Um, Look, it's basically all the things like doing an audit, doing a paper writing. It's everything is you know scores you high. There is nothing called as like mandatory, but it will score you high. So your chances of like if you are entering into a training program, the chances are high that you will score yourself high, and then you will be much more ahead in the ladder.
Okay. One more question is there. If have to do research in stem cell or transfusion medicine in UK, do we have to clear MRCP or PLAB? Or directly we can apply in hospital or college?
You can directly apply for hospital in the colleges. The only one thing in what I know about UK and what I have realized after coming here, that if you want to go in research, any research, all the research are funded by the NHS here and funded by the government here. Okay, so even if you want to go into the research, uh, basically you have to have a very good module what you want to research, and they usually prefer the candidates either like who have done not the training but who have done the basic education here, or who are the residents of in this country. It's very simple why they want to fund your research, like if you're not willing to stay here. So because it's all government funded. So if yeah, if you get any sponsor who is ready to work with you, or like you are able to come and help you, then yes, why not, you can do that. But again, in terms of financial implications, if you are coming for research, the salary would be a bit on the lower side, so you might need to do a second job as well if you really want to pursue your research.
Dr. Gaurav?
Yeah, hello, ma'am. Ma'am, actually, I wanted to ask. I just finished my fellowship from MCC. What
Yeah.
I'm heading towards is a stint in the BMT unit at TMH Mumbai. So I wanted
Okay.
to ask how beneficial would it be while I'm preparing for MRCP? How would this SR-ship help me if I do decide to pursue it?
So I didn't get your question correctly. Like you are asking me that how this fellowship would help you in preparing for the MRCP.
No, ma'am. Actually, the thing is, I've completed my fellowship already, and I am heading for another stint as SR in BMT unit. So I wanted to ask whether this experience in BMT unit is also going to be beneficial for me preparing for MRCP.
It won't help in preparing for your MRCP, but yes, like it would, definitely help you, and it will be on your experience when you decide to come to UK, after MRCP, because it will count as a number of years of experience. And if someone sees that you have worked in BMT, that's great actually. So you can apply for any of the hematology jobs in transplant centers.
Okay, ma'am. Got it. Thank you very
But
much.
yeah, so the other way would be down, like if your MRCP will help you in sharpening your clinical skills while you're doing a BMT then.
Right, ma'am. Right. Thank you, ma'am.
No worries.
Anything more? Anyone? Okay, so I think this 1 hour was a great eye opener for everyone, like regarding what all can be done, or the route map to practice or studying in UK. Everything has been brought to light by Shweta in a very like understandable and basic or simple way also. So I hope it was useful to everyone too. So I would like to thank Shweta for being part of our for our talk in Transfusion Medicine Academic Society, and personally from me too. So thank you. So see you soon. Okay.
Thank you,
Excuse me, sir.
Rafi.
Sir, excuse me, sir.
Yeah,
Yeah,
yeah.
So one more question came.
Okay.
yeah, sure.
After clearing MRCP 1 and 2, how can we proceed to get job in transition medicine?
Uh, that's a good question, but frankly speaking, I don't have answer to it, and that's what we were discussing. That I am still not able to find it out. That after doing MRCP 1 or 2, how can you get a job in the transfusion medicine? Because as far as I know, as simple, it's very simple, because if you're clearing an MRCP 1 and 2 and you are going to come to UK, definitely your expectation would be to be consulted to transfusion medicine. And whatever I know about here is, all the consultant in transfusion medicine here have already done FRC path. So, if I'm doing an MRCP 1 and 2 would help you to give FRC path. Yes, I can say that. And then you can, carry on towards doing a transfusion medicine. But again, I think this, to my knowledge, it still needs to be explored. That I don't know, because I don't know. The answer is, maybe someone can come and work in transfusion medicine, but I don't understand what job you will get if you're coming with MRCP, because there is only one consultant and there is no clinical associate or specialist registrar in transfusion medicine. And for to be a consultant, you need to have an FRC path.
I think there's one more last raised hand, Dr. Divjot Lamba.
Yeah.
Yeah, thank you for the insights. I just have a question like for our juniors who have doubts, like FRCP path can be done directly without the MRCP, and can it help to get a job there or not in transfusion?
Yeah, FRC path you can do directly, but again the question comes is like, so we need to understand that FRC path is like we are doing it for clinical hematology, right? So if you're asking me that, like, a candidate, for example, if somebody who has done, transfusion medicine and want to go directly for FRC path, it would be very difficult exam. The first thing is like part 1 is clinical hematology. So that means like the candidate has to know everything about leukemia, lymphoma, myeloma, clotting, transfusion, everything. It's not only transfusion
Yeah,
medicine. So to pass that
okay,
exam, so it's better to do clinical hematology to go to do the FRC path exam.
okay. Thank you.
Thank you once again, Shweta.
Thank you,
We'll
Rafi.
like
I'm not sure
like
whether I confused people or whether I have made things clear, or maybe
yeah,
after this talk, many of them maybe, yeah.
most of the things I think you have made it clear, because FRC, the importance of MRCP and the various pathways also you have told. And I think you can, if possible, put down your email ID just in case, not your phone number. In case if
Mm.
anybody has a query regarding the same, they can just contact you also in the
Yeah,
chat box.
yeah, I
Can
can
yeah,
put that.
you can just put in your email ID so that they can.
Okay, fine, I can do that. Can you see now?
it has not yet come. Maybe
Maybe I did. I'm so poor with technology. So my
you can
email
just
ID.
WhatsApp to me. Yeah, you can just WhatsApp to me. I'll
Yeah,
put
I
it
can
in.
do.
Yeah.
It's basically
So I'll
Dr.
put.
Shweta21@gmail.com. Anyway,
Yeah, yeah,
I'll WhatsApp you. Yeah.
yeah. So thank you once again, Shweta.
Thank
During
you.
your morning,
Thank you all.
it was early morning, 8 o'clock, I think. So you had your night duty yesterday, and thank you for being part of this program.
Thank you.
Thank
Thank you.
you. Okay.
Take care,
Bye
everyone.
bye.
All the best. Yeah. Bye.
Sure. Bye bye.
Bye.